Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. I'm Solomay Tibabu. I'm the host of the Expanding Access podcast, where we discuss all things expanding access to mental health, addiction, and IDD services through technology, health equity, and innovation. So, of course, I am so excited for two very special guests with us. We've got so much to cover. Thank you so much, Rob and Shrenik, for being with us. Maybe just to get started, if you each could do a very quick introduction. Who are you? What's your role? And then we'll get into it.
Happy to, Solomay. I'm Shrenik Jain, founder and CEO of Marigold Health, and we're on a mission to expand the role of peers in our treatment and recovery system.
Great. Hi, Robert McAlonan. I'm the Director of Behavioral Health at VNS Health in New York.
Well, and now, of course, I have to ask you both a little bit more about that. Shrenik, tell us a little bit more about Marigold. What is it? What problem are you solving in behavioral health? How did it come to be?
Yeah, happy to. So, like a lot of folks working in the space, I am someone in recovery myself. The work is deeply personal. I would say at the highest level, what Marigold is doing with peer support is really about solving an engagement gap, right? We have a sort of fundamental engagement gap in terms of people really only, for the most part, seek support and clinical treatment for a substance use or a mental health condition quite late, after suffering for quite a lot of time on their own. My personal background before I was starting Marigold was I was actually an EMT and a firefighter. So I was writing responses to 911 calls, started doing that when I was like 15, 16. It was an eye-opening experience, right? I mean, beyond sort of what I was dealing with personally, I could see how really people are held back by their own sort of worst habits. And I saw a lot of fellow first responders struggle with things like trauma and substance use. And what I saw that was really, I guess, like the most disturbing was a lot of times my peers, these other first responders, they were able to recognize like, hey, I have an issue. Like I really maybe don't want to be drinking the way I'm drinking, but the cost to raise your hand and sort of label yourself as someone who is seeking services for a substance use disorder, I mean, it basically would have been career ending. So it really did get me thinking about how the current supports, they don't really meet individual expectations for convenience and privacy. And what my team and I had also really been interested in was the fact that 12 Steps, AA, online communities like Reddit, people actually seek out these types of supports before they seek out clinical care primarily. And it's sort of like this whole parallel world where people who've achieved long-term recovery can give folks non-judgmental, super practical guidance for how you can basically create a path to recovery on your own terms. So with Marigold, what we are essentially doing is providing high-quality, scalable peer support services. But at the core of our model is mutual aid. It's these 24/7 support groups on our mobile app where members can help each other. And then we have a workforce of certified peers that follows up to provide more individualized support when needed. But it's really combining that supportive recovery community with the more involved coaching from a certified peer.
It's so awesome. And I have had the pleasure of getting to know Shrenik over years, and it's just so inspiring, the impact that you've had. I can't wait to dig into that a little bit more. And Rob, for you, if you could share a little bit more about VNS Health and especially how you're both a health plan and a community provider. Did I get that right?
Yeah, that's right. Thanks, Solomay, and thanks for having me. Super excited to be here. I'm a clinician by background. I worked in clinical mental health and SUD programs for a long time. At VNS Health, as the Director of Behavioral Health, I get to be involved in a lot of really fun projects. VNS Health has been around for 130 years and is one of the largest nonprofit home and community-based organizations in the U.S. We operate as a statewide health plan across New York with several products, including a fully integrated MAP plan and it gives us the ability to integrate care and manage risk. We serve more than 60,000 members across New York State through our plan products. Many of the people we serve have complex needs, and it's really about seeing and caring for the whole person. And I think that differentiates us a little bit. Our mission at VNS Health is to deliver high quality, cost-effective care in the home and community, especially for individuals with complex needs. I think that at a high level, the healthcare system can be super overwhelming and complicated, especially as people get older and need more and more support. So that's why we're focused on making it easier to understand and simpler to navigate. I think this project with Marigold is one way that we hope to do that.
So great. I know for both of you, it's a priority, and both of you have built models centered around trusted human connection. I'd love to just hear a little bit more about how this partnership came to be. Maybe Rob, I'll start with you this time.
Yeah, thanks. The inception of this partnership started early last year. Our CEO, Dan Sabat, is really passionate about making sure VNS Health is on the forefront of innovation so we can provide the best member experience possible to all the individuals that we serve. Partnering with Marigold was really a natural fit for us. As Shrenik stated, Marigold offers a unique blend of traditional peer support and smart technology. It enhances how individuals with SUD are supported, and we were really excited to get involved in that. We also saw the meaningful impact that they've had with other health plans, engaging members in their comprehensive peer support product. So we felt really strongly that Marigold could help us meet some critical care gaps.
Thanks, Rob. I mean, to build off that, I think there's just so much alignment between our organization's shared missions. For Marigold, a lot of where we start is when we think about digital engagement, to your point, the healthcare system can be overwhelming and complicated. And when you're experiencing that as an individual, a lot of times it's not convenient or practical for people to think about their own healthcare needs and how they would act on it, right? They're juggling life commitments, maybe they're caregiving, maybe they're working. And really, we see the digital piece as sort of a really low friction sort of front door to receiving services. If you're on the bus to work, you can download our app, connect with a certified peer, connect with other people who are doing sort of their own journeys through distinct but similar experiences. And that's a really powerful tool in activating individuals to think, hey, well, maybe I can expect more. Maybe I can actually change this habit, or I can get supported around this, and I'm not alone. And then that's oftentimes after a little bit of time in our groups or working with the peer, they express more of a willingness to see a primary care doctor, to use some of those other services. So it's really about combining the sort of reach and convenience of the digital support. You get help from a time and place of your choosing, with actually following that up to turn that into sort of sustained behavior change where the individual is really driving that. They're really at the front and deciding, how do I want my recovery to look like, and what are the most important goals to me?
It's just so incredible. I'm really excited about the prospect of how many individuals will be able to get support as a result of this. And maybe, Rob, if we could go back to something else that you touched on a little bit, is what were some of the challenges in behavioral health access that you were seeing that really made Marigold an attractive partner for these specific issues?
Yeah, when we started looking at Marigold, what we found was not so much of a challenge, but more about an opportunity. I think peer support isn't just a nice to have add-on anymore, if it was at one time. It's really a core part of our behavioral health network. It brings that lived experience, real connection, and it's proven to boost engagement and outcomes. I think it's become really essential and not optional. And so we saw that for our population. I don't think generally across BH that we're even close to fully operationalizing it as a truly core service, but hoping that we get there. So one of the things we realized at VNS Health is that only a very, very small percentage of our members were accessing peer support services each year. So we needed to find a way to make peer support more accessible, especially during those critical moments when traditional outpatient care just isn't available. Even if members are engaged in outpatient services, they can't access those providers in the middle of the night or on the weekends most of the time. The only place they can go for help is the hospital. So Marigold is a support to our members when they need it the most. And we see that that can help reduce unnecessary ED visits, detox stays. It's really critical. I think that we target individuals coming out of inpatient and residential treatment because that's when folks are most vulnerable to relapse, as that work of building in the structure and the support systems that they need to find success in their early recovery is still in early stages.
That's so great. Shrenik, I'm guessing through your conversation with other health plans that you partner with, you've seen similar situations and challenges. For those peers in the audience, can you talk a little bit about how Marigold's model is operationalizing peer support for large plans like VNS? It's kind of flip question.
Yeah, of course. I mean, I think candidly, I think the challenges Rob mentions with people not really accessing peer support as part of that continuum of care, I think they're widespread, they're endemic to the industry. And I think the way we think about it, right, is we are in sort of such an interesting place, especially if you look at, say, let's take addiction care, right? Like as an example, we have across this country a multi-billion-dollar sort of industry around short-term inpatient stays with 90% plus relapse rates, right? So you have all that money going into, in many cases, it's needed, say, clinical stabilization, but the follow-up is lacking. And you've got something like AA, 12 steps, these Reddit communities that are totally free and grassroots, right? I mean, that's kind of the wild thing, is that people are intrinsically motivated to do this. You have millions of people in long-term recovery who are either sponsoring or willing to give back in that way. So Marigold's task is, how do we keep those parts of peer support that make it engaging, that make it authentic? And, it's at its core, it's a subclinical intervention, but at the same time drives a very powerful clinical outcome. So we think about things like, how do we incorporate best practices of, say, measurement-based care, right? In terms of having the members do outcomes assessments regularly in our platform, in terms of having very clear documentation standards for the services we deliver. So it's not just sort of from a compliance perspective, but it actually facilitates collaboration across different care teams, because traditionally, right, that's not a core competency of high quality peer support. So we're kind of entering this new age where we're recognizing that for behavioral health care to truly be effective, it needs to stay with somebody in the community. And you can't sort of snap your fingers and immediately create enough outpatient providers if you were able to get everyone who had the need to go and seek that help. So you have this latent capacity in terms of your members who've already achieved recovery. We sort of see ourselves as activating those folks and then plugging them into those other network providers, right? So to VNS's point, right, VNS has been providing community-based care for over 100 years. It's really important to us that we're complementing the work of those existing network providers. And because we have more of a sort of technology layer in how we deliver the service, the level of transparency and visibility we can provide to our clinical partners and our plan partners that's as specific as, at this time, this member logged into our support groups, they mentioned this need, and we followed up with this referral or this one-to-one support within this time period, is really new and really exciting for integrated peer models. So we sort of think about it like, how can we take the sort of things we know are best practices for a high-quality behavioral health intervention while staying true to that scope of services for peers, which is subclinical and at its core really about building trust and engagement.
Yeah, if I could add on to that, I'll also say, at VNS Health, one of our core values is agility. One of the reasons I think this partnership has worked so well so far is how streamlined the collaboration has been. Shrenik and his team have kept things really focused, and they've worked closely with kind of a small team here at VNS Health, myself included. So we have this very small, agile team, and that's made it easy for us to move quickly, make decisions, and actually get things done.
It's wonderful. And Of course, this can't be a behavioral health innovation podcast without discussing advancing to value-based care models. So maybe Rob and Shrenik, I'd love to ask both of you if you have any advice for the plans in the audience around setting up value-based partnerships with innovative behavioral health providers. Where should they start and what should they think about?
Yeah. So first of all, I think you have to go into these kinds of relationships with a long-term partnership mentality. We all want quick wins, instant gratification in today's culture, and the healthcare world, I think, is no different in some ways. In behavioral health, we've been talking about value-based payments for as long as I can remember, but the actual transition has been very slow overall. My background being more on the clinical side, so I'm kind of biased here, but I think that it's important to trust in the clinical justification, the probable clinical impact, and the cost piece will fall into place. I also think it's super important as the payer to be open-minded and receptive to hearing from providers about what it's like today working with the population that they're serving and be open to changing the way we think about things. I have a mentor who made me a believer that the payer and the provider network should work collaboratively with the goal of creating the most seamless member experience possible, especially when navigating behavioral health services or really healthcare services in general. With Marigold, it's been really easy to collaborate. In my opinion, they've been in the driver's seat when it comes to design behind how we make this work and how we operationalize it, just trying to support that process and keep it running.
I mean, that multi-year mindset is really critical. I'm glad Rob led with that because, I mean, just fundamentally, right, the average person from the first time they raise their hand and actually seek some type of substance use disorder treatment, right? This is not how long they've had an addiction. This is how long since they sought treatment. In and out of care, episodic for 8-9 years before you see that first year of sustained recovery. So if you want to see if the intervention actually works, like you've got to actually stick with these members for a long period of time. And as Rob has mentioned, like that holistic approach, which is the direction the whole healthcare industry is going in, is really important because even if someone is, say, still using substances, if you can see that they're actually more proactive on parts of their physical health, right? Like they're mindful of their sleep, they're mindful of their exercise, they're working towards those goals. If you do that, you can actually start to get a much more complete picture as to, what this person is dealing with and how they see themselves getting better. And then by extension, right, like what resources do we connect that person to so they can make that a reality? Of course, we think payment models, and there's certainly a range of innovative payment models that we use in our partnerships with plans. I would say for peer services in particular, you actually have a pretty good menu of different approaches you can use to structure things on the payment sides that are sort of established and proven to be effective. But the issue remains that the vast majority of the people who could benefit from peer support still don't get it. So you really have to start by indexing on, okay, who are we going to engage? What are the sort of types of needs we're going to support? And like, how do we stay with those folks for a long period of time? And I think we'll talk a bit about quick wins later in this podcast. So there certainly are quick wins. But if you really want to structurally change how your members with substance use disorder receive support, and by extension, right, what you pay in terms of total cost of care for those members, we've kind of just got to wake up to the reality of, hey, it's a big problem today. It's going to be a big problem in 2 years. It's still going to be a big problem in 5 years, right? So what can you actually do with the partner that's going to compound, right? Where you take advantage of that trust and those workflow integrations that you build, and you're actually getting a lot more value out of that in year 3 than you were in, months 5 and 6.
Embedded in what I'm hearing you say, Shrenik, as well, is just really doing a good job of setting expectations. Just the example of the time for recovery. I mean, that sounds critically important. And maybe if we could just take a step back, I know that a lot of folks in our audience are super interested in peer support, but might not completely understand what are some of the barriers to launching. Shrenik, can you talk a little bit about what you're seeing are the biggest barriers to scaling peer support today and what's working as well, of course?
Yeah, of course. I mean, I think that that's a topic that if you just sort of try to dive into it de novo, it can feel overwhelming. But when you really sort of sit down with an invested partner and map it out, it's actually a pretty concrete set of operational challenges that stem from the fact that peer support is not traditional clinical care, right? For example, a common sort of challenge or a thing you need to work through with the partner is how do you credential certified peers? States have established a certification that is, generally speaking, not equivalent to a licensure. So, what's the approach you take to essentially credentialing a peer agency as a network provider of sorts? There's lots of flexibility there. I mean, for example, you can credential supervisors, but I think thinking about how do you ensure sort of quality and consistency in the workforce is important. And a lot of the peer agencies out there, of course, I think Marigold is among them, have a pretty good set of strategies for how you create that recovery supportive environment, how you not just hire very capable peers, but actually develop those peers over time and sort of think about something like CEUs, which you're very familiar with for licensed providers. We've invested a lot in terms of continually deepening our peer skill sets around things like integration with specific types of treatment like MAT or working with primary care. And you sort of need to, ultimately just like look sort of at the policies and the protocols and the workflows that your partner has in place and think about, okay, like what's a sort of reasonable way to sort of represent this in our contract in terms of a guarantee, in terms of how this goes through our existing credentialing process. And then the other big thing that I would say is in terms of modalities of support. Peer support is this wraparound intervention that is fundamentally most effective when you recognize that it's not really about getting the member to spend hours and hours of time with an individual peer, though it's great when that happens. It's more about connecting them to the support right when they're activated to receive services or when they're in an acute moment. So that means text is indispensable. And you have a lot of folks who they don't engage with a sort of traditional one-to-one, face-to-face peer coaching that a lot of community providers already offer. And there's this whole population, right, that'll basically engage with that modality. Now, of course, there is sort of alignment you need to have with your partner in terms of, for us, a big one is just essentially clinical documentation, right? If we're able to create the high quality progress note from a text-based interaction that you would see from an in-person interaction, it's basically the same intervention being delivered. And plans generally have this flexibility, especially post-COVID, to think about sort of broadening the aperture in terms of modalities that an existing service can be delivered under. But it's at its core, it's very operational, right? It's very much like, how do we get this service that is covered and technically has been covered for a long time to sort of operate and flow through like any other network provider, which like sort of reduces the friction, right, to turning on a partnership and working with the plan. And there's things where the industry is progressing where, for example, 5 years ago, there was no major accreditation that would have been a good fit for Marigold, given that we have a very strong team of clinicians in supervisory and oversight and sort of outcomes analysis role, but we don't prescribe medication. We don't bill for clinical services. Today, we have a URAC accreditation. There's a Joint Commission accreditation that actually applies now as a telehealth provider. But it's sort of these things are like moving forward together. So you do sort of have to just like kind of roll up your sleeves and work together. But when you start getting into the blocking and tackling, you realize that it's not actually, maybe as daunting as it would first appear, because there are standards for what does it mean to be a certified peer? What are the core competencies? What are the competencies to supervise the peer? These pieces exist, but because the service is not really being delivered at the scale that, would be optimal, you're presented with some sort of novel questions on how you want to operationalize that as a plan. And there's quite a few options to work through that.
This is all really great advice, candidly, for those listening in to learn about how to launch a successful partnership between payers, providers, innovators. If I could ask each of you just really quick, what would you describe as a quick win early on in a partnership like this? You, Rob, and then Shrenik, please.
Great. So I think for me, I want to see peer support utilization across our members at VNS Health grow exponentially very quickly. That's a clear, quick win from my perspective. We've still got a lot to learn when it comes to the impact of peer support for the population we serve. So I'll be looking at things like who engages, why, for how long, what keeps them coming back, and how that looks across different groups. It's exciting for me to see how Marigold's platform will give us real-time feedback, like Shrenik was mentioning before, and we can learn and adjust as we go. Beyond engagement, we're really looking at how this boosts member satisfaction, retention. Those are super important to us at VNS Health. When people feel supported and connected, they're way more likely to stick with their care and with us. Real quick, I think beyond utilization, engagement, satisfaction, the primary focus, and this is probably getting into more long-term, but just quality, right? One of the biggest goals with peer support is cutting down on hospital readmissions, especially for members dealing with those complex behavioral health needs. So from a quality metrics standpoint, this directly supports improvement in HEDIS measures, and that's something we'll be looking at down the road.
I think the point on transitions of care is huge, because what you really will expect to see is, on one hand, a sort of like growing base of members sort of self-referring, raising their hand and engaging with peer support, as well as a more targeted approach where we're essentially saying, how do we make sure that we are reaching folks at that key moment when they start outpatient care or when they're leaving an inpatient program? And, that's the direction the industry is going in, right? NCQA recently has updated their definitions for some of these metrics, where a touch point with the peer actually counts in the numerator for some of those key follow-up metrics. So that's a super quick win. And of course, the reason those are quality metrics is because they are linked to downstream total cost of care. And, at the global level, if you look at someone starting outpatient behavioral health care, what are the chances they're going to be there in 30 days? Somebody's leaving inpatient care, what's the chance they get a follow-up? Super, super high level as an industry, it's about 50-50. It's still about a coin flip. So if you're able to actually show not only we're getting a lot of engagement, but we're actually able to embed this within those workflows at those key care transitions, even things that are simple, because most plans have a discharge planning workflow. Most plans do some outreach already around these points in the member care journey. And we found that by just having a peer doing the phone call or sending the text message, you get a better conversion rate because of that sort of non-judgmental and more human-first approach. So if you can sort of see engagement across your continuum of care, that's a pretty quick win.
So, Rob, where do you see the right balance between community-based and digital providers?
Well, that's an important question, Salome. And I think really what it boils down to is the digital tools can really scale engagement and access, but that engagement is a lot more effective if it is a bridge to those other community-based programs that already exist and we know can already deliver high-quality services. And vice versa, right? If someone's in those community-based services, their chances of being retained in that care are dramatically increased if they're getting support between visits. So it's really a synergistic relationship.
Payers can really drive collaboration by making it easier for digital and community-based providers to work together. So we as the payers, we need to be, in my opinion, the liaison to see that those connections happen and that they're successful. So that means being flexible during contracting, having shared data, enabling shared workflows, and payment models that are set up to be more rewarding outcomes, not just services. I worked on a separate project a few years ago where we had a digital BH company and they gave community-based network providers access to their measurement-based care platform. So we had all this data in real time collectively from the network, which is outside of claims data, somewhat rare. And I think in that situation, I think the payer is the leader in the project, but only in a supportive function. And it was really fun to see it happen. In my experience, when everyone's aligned, collaboration becomes the norm and not just the exception.
That's a great example, Rob, because we're really looking to do something similar in terms of using our platform to support peer services that are delivered by existing network providers as well, in terms of giving peers at these other agencies resources and specialized supervision to lean on, in terms of sending referrals for folks who really want that more face-to-face engagement. And then the thing I'd really put out there to the audience is to recognize that while there is a compliance burden, there is an investment required to execute a BAA, to get sort of secure file transfer back and forth, that investment is really valuable because that is what's going to give you the plan a lot of visibility into what's actually happening. And for the provider perspective, we know that claims don't tell the whole story, but if you can layer the claims on top of the information you're learning by directly engaging the members, that's when you really get that more complete picture. And that's really when you can start to get a lot more creative also in years 2, 3. What kind of outcomes are we going to incentivize? Because you're going to have a really clear idea of who you're reaching, why they're being retained, and what other services they're using or not using.
What advice would you give to help plans thinking about partnering with peer agencies?
So my advice, Salome, would really be to really think beyond piloting and thinking more about a sort of foundational, longer-term partnership, like we said at the start of this call. Because at the end of the day, peer support is an evidence-based intervention. The outcomes for high-quality peer support are robust and measured in a bunch of different ways. It's really more about how do we work together to get that peer support to the members who need it most when they need it most. So I think that also as a plan, you recognize that there are a lot of services that members need that are covered that a plan doesn't have a lot of direct ability to sort of immediately change access or the volume of network providers. Whereas for something like peer support, where you actually have thousands of people in long-term recovery that can be activated as peers, that can get certified, in well under a year, you actually can sort of put your finger on the scale and see that exponential growth in services. Like that's a very realistic outcome. And it's something that's complementary and not competitive to those existing network providers.
Rob, what advice would you give to startups that are hoping to partner with health plans?
I would say understand the world that you're entering. Health plans are complex, but not slow by choice. The best startups learn our operational language and bring us real solutions, not just technology. So if you can integrate with our workflows, show transparency on outcomes, and make our members' lives measurably better in the process, we will move mountains to partner with you.
What is a joint takeaway?
Well, I think the key takeaway, Salome, is that partnerships work when both sides bet on the other's success.
Yeah, exactly. I agree with Shrenik. When the startup brings speed and the plan brings scale, access expands for everyone.
Now, for my last question, if we were to fast forward 2 years, what do you hope people will say about the VNS/Marigold partnership overall?
I can kick that off. I think there's a lot of really cool, innovative things going on out there when it comes to access. A lot of that is highlighted on this podcast series, but I see no reason why this partnership cannot set the stage for other payers and other states to follow a similar strategy, especially when the impact is what we really hope and expect it to be.
Couldn't agree more, Rob. I think it's really, one is I see ourselves as hopefully a model for all sorts of plans and payers who are trying to understand how do I scale peer support in a compliant way. And I also am really excited to show some outcomes that show not just your sort of usual, do we reduce acute behavioral health stays, but really showing that we are driving improvement on sort of the broader set of chronic medical conditions, right, that really determine someone's overall healthcare trajectory. Because we all know from personal experience that that is something that peer support can engender in someone, that that's something that peer support can empower folks to do. And we're really just showing that a plan and an organization like Marigold can partner to take that to the next level of scale. Thanks so much for having us, Salome, and putting a spotlight on this partnership. We're really excited to see how this goes.
Yeah, thank you so much. This was great.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.